So ndenze ingculaza okanye i-HIV ndaye ndazifumanisa ukuba ndinayo, ndizifumanisa ngonyaka 2001. Ngaloo nyaka ke ndandimane ndiphathwa ke kokugula kwefiva, ndimane ndifumana ifiva ephinde ibuye iphele. Waze ke ugqirha endandinaye endisenaye nangoku uDr Bam wandenza netest ye-HIV. Ndasiwa ke ikliniki ke inceda ke ngamachiza ke ARVs ese-side B. Ndabe ke ndincedwa ke ngugqirha kuthiwa nguDr Gilles owathi ke wandiqalisa i-ARVs, kodwa ke kwanyanzeleka okokuqala uba mandilinde ithuba lam. Ndabe ke ithuba lam ndilinikwa ngo-April 2002. I-first line yam endayithi ndayinikwa ke nguDr Gilles yaba yi-3TC, i-nevirapine ne-D40. Ndazisebenzisa ke loo machiza ke andiqhuba kodwa ke kwafumaniseka ukuba ndiyayifelisha i-first line.
Your viral load has been high for a very long time now. And the first line regimen cannot be used anymore. You need to change to a second line regimen.
What is the second line regimen? Can you explain for me?
Okay, second line are other ARVs that are more powerful.
Okay.
One of them is Khayelitsha, and I will explain to you what it is. Another one is 3TC, okay. And then because AZT and D40 do not work with you anymore, we have to import a drug that is not registered in South Africa yet, which is Tenofovir.
Is it not going to be a problem that the drugs are going to be ordered like in another country?
It's called the Section 21. It's an authorization to the drug regulatory body in South Africa, because Tenofovir is not registered in South Africa. It's not a drug that is allowed to be used in South Africa without special authorization. Tenofovir is actually a fantastic drug as the drug itself. Why? Because it has a very good safety profile, very little side effects, no lactic acidosis reported until now, or even though maybe there is, but very little. There's no peripheral neuropathy. Second advantage of Tenofovir is once daily, one tablet, which is easier to take than twice daily tablets. And then the third advantage is that it has a very good resistance profile, which means if you put Tenofovir in first line, for example, Tenofovir 3TC, nevirapine or efavirenz, and you fail your first line and you stay on that failing first line for some time, you're not going to develop HIV strains, or very little, that are resistant to the second line, as you have with the current first and second line option. Thank you, Manwabisi. The form is filled, that's fine. Now we have to, well, I will give this form to the MSF office, they will send it to the MCC. We wait for the MCC to give an answer if it's authorized or not, but don't worry, usually it's authorized. And then we have to send the authorization with the whole dossier to the United States, to Gilead, which is the company that makes Tenofovir. And then we'll have to wait till they send it to South Africa, which might take a couple of weeks, definitely.
Sure. Thank you, Dr.
Tenofovir was filed for registration with the Medicines Control Council by Aspen roughly 7 to 8 months ago. It is on a fast track. What that means is certain drugs, when they're declared to be emergency drugs, such as this one, the Medicines Control Council has a fast track process. We've been approved for fast track, and roughly the period for fast tracking is between 12 to 15 months in our experience. So I'd say we're pretty close to receiving registration if you work on those time frames with Tenofovir.
Once Tenofovir is registered, we're going to need to change the national rollout program, which is going to involve, first of all, retraining the staff. It's a different drug with a different side effect profile. We need to get that education message out, and we need to add some extra safety bloods to what we're currently doing. I think to pressurize the government, there are numbers of activist organizations. The TAC is involved in also trying to expedite the registration of Tenofovir. The South African Clinician Society, which is, by the way, the biggest collection of HIV clinicians in the world, is also advocating the movement of Tenofovir towards a registered drug.
The benefit of having the product registered is that physicians, clinicians, other healthcare professionals will be able to prescribe and dispense this drug. So that is the benefit of registration.
Come in. Hi, Murabisi, have a seat.
Hi, Professor.
How are you?
I'm feeling all right.
Good.
I hope you have got some great news for me.
Well, the good news is that your Tenofovir is arrived.
Ooh, at last. I've been waiting for this Tenofovir for quite some time.
Okay, your next date will be in 1 month's time from now.
Yes, that's very nice.
You bought your shopping bag. Good, all right?
Yes.
And there's nothing else that you need, so I'll
Yes.
just take the folder back to reception when you're done.
Okay, that's good.